Hi, my name is Deidre Lockley and I'm the Senior Social Worker for the Children in Care Service within the Education Department's Student Support Services Division. Today I'll be speaking with you about children in care, some of the things that we know occur for children in care because they are no longer living with their family, what this means for schools and some of the things that you might be able to do in your role. So thank you for listening in today. First of all, I'd like to acknowledge that the land that I'm sitting on at the moment is the land of the Kaurna people and recognise them as the traditional custodians of the land and acknowledge their elders past, present and emerging. We know that there are a high proportion of Aboriginal children who are in care and that over 30% of the children in care are from Aboriginal families. And I recognise that that has an ongoing implication for culture and for Aboriginal families in our community. The Children in Care Service endeavour to work strongly with our colleagues across education and child protection and really recognise the cultural authority of those people who we're working with from an Aboriginal background. So you can see today from the slide that you are looking at, there's a few things that we're going to talk about. One is about the background of what it means to be in care. And then we'll talk about some of the resources that are available for schools, teachers and SSOs to support children in care who are at your site. We'll talk about some practical strategies. And then I'd like to talk to you about some of the things that children in care want educators to know. Children in care is a name that we use for children who have been formally removed from their families. Previously, that was known as children who were under the guardianship of the minister, and sometimes in schools we used the word GOM. However, a few years ago the legislation changed and now children who are in care are actually under the guardianship of the Chief Executive of the Department for Child Protection. So we no longer use the word GOM. We use the word children in care. So at the moment, there's about 4,500 children in care within South Australia. 2,500 of those are in SA government schools and approximately 200 are in preschool. This is quite a big increase. 5 years ago, there were only 3,200 children in care. And so I know that when we speak with schools and preschools, they often feel that there seem to be more children in care at their school, and that is borne out by statistics as well. There are more children in care now in our community and in our schools. So it's worthwhile knowing how children come to be in care. Children are removed from their families when they're unsafe or at great risk. This occurs through the Department for Child Protection. Some of you will have been involved in making mandatory notifications at some point in your time in schools. And so that occurs when you feel that a child is greatly at risk or unsafe, and that you'll make a notification to the Child Abuse Report Line. When those notifications are substantiated by an investigation by DCP, if the conclusion is that the children can no longer stay at that home, the Department for Child Protection goes to the youth court and seeks for guardianship of a child. Most children in care that you come across are under guardianship until they're 18, and that means they are in the care of the state until they're an adult at 18 years old. One of the things that you'll notice that is different about children in care to other children and young people is that children in care have two kinds of parents. They have one parent who's their legal parent, and they have another parent who is their carer, who cares for them in a day-to-day sense. The role of the legal parent is taken on by a caseworker within the Department for Child Protection, and they are the people who have the legal responsibility to sign off things like enrolment or make decisions about their medical procedures. But most of the time, children in care spend their day with their carers. Carers can be people who they know, they can be family members or extended family. Those people are called kinship carers. And the majority of children in care have this kind of care arrangement. Other children in care are cared for by foster carers or foster parents. And they are people within the community who would like to welcome a child in care into their household. And that's the second largest group of carers. And the smallest group of carers are residential care staff. So some children don't live in family-based care. They live in homes where they're cared for by adults who are rostered on in shifts to take turns in caring for them. We call this residential care. Some children live in a house by themselves with adults who rotate their care. Some children will live in houses with siblings or other children who they don't know. Residential care accounts for about 15% of children and young people who are in care. As you can understand, this can be a really difficult place for children to live, given that they might have between 5 and 10 different individuals who take turn in caring for them. And this can have some really significant impacts on their daily routines and has significant impacts on schools as well. So schools are really important for children in care. They're important because they can be the most consistent place in their life, particularly for children who are in residential care. The staff who they see at school, either their teachers or their SSOs or the person who is at the front office or runs the canteen, they can be in their life for between 5 and 7 years, depending on what part of school they're in. And that can be a very important relationship for them. It can be challenging for preschools and schools to support children in care. This can be due to some of the complexities in their behaviour and in their ability to learn. So there are a number of resources that are available from the Department for Education which can support schools or students directly. There are some resources that are available to support schools as a whole and particular staff members. One of those resources is the Children in Care Service, which is the service that I lead. The Children in Care Service aims to be a support for schools as well as DCP case managers when there are concerns around the educational progress of an individual child in care. We particularly become involved when the normal processes that schools and DCP might use together through their conversations and problem solving can't overcome the barriers that are affecting that child's ability to learn. We will work with schools to help them build their capacity and understanding around children in care generally, as well as the things that might be occurring for that particular child. And we can also work with the Department for Child Protection caseworkers to help them have a better understanding of the needs of school and how things like residential care can impact on a child's learning. Another resource that schools have is the Trauma Aware Schools Initiative and SMART training. The Trauma Aware Schools Initiative and SMART training are ways that schools can build their capacity and understanding of how trauma impacts on children and their learning. It provides professional development and training for small groups or whole of school staff teams to provide information around trauma and how schools can respond. SMART, which is the Strategies for Managing Abuse-Related Trauma program, is delivered by the Australian Childhood Foundation, and there are a variety of topics that can be accessed either through Plink or on face-to-face training. And these can include having an understanding of the neurobiology of trauma, understanding how self-care is important for staff working with really complex children, and providing strategies for classrooms and individual small groups for children in care and other children who might be experiencing trauma at home. Another support for schools is student support services. Children in care are a priority group for student support services and means they have priority in waiting lists for psychology, speech, behaviour, OT and special education. And these are resources that are available to all schools and preschools for children who have additional needs, including those who are in care. There are resources that are available which directly support children themselves. Children in care are able to start preschool early. They can start from the age of 3, which provides them with that targeted early intervention that can be so beneficial for children who've had a difficult start to life. Children can also access mentoring and tutoring through the school retention program. These programs are targeted only at children who are in out-of-home care. The school retention program can also provide funding for school-based programs for small groups. This might include art therapy or labs for life. This is particularly important for children who are struggling to engage at school. Children in care are all entitled to have a one plan, which is a process that DCP caseworkers and carers and schools together can use to plan for the goals that children might have for their educational progress and work together to think about how any barriers that might exist can be overcome. Children in care also have the opportunity to select the high school of their choice when they're moving from primary school. This is the only time that there's prioritised enrolment for children in care, and it's important for caseworkers and carers and children in that final year of primary school to think carefully about what is the best match for them and their circumstances. In the recent months, there's been a new funding approach released for children in care. This is transition funding. When a child in care moves schools, if they are not currently funded through the IESP program, the new school is eligible to receive transition funding. This funding is available to help the school to put in place resources to make sure that that transition is smooth. We know that transitions are hard for all children, but they are particularly difficult for children in care. Information about each of these resources is available on our Department for Education intranet. So there are a number of practical things that schools can do based on trauma-informed practice that support children in care. Often these interventions support other children as well. Providing calm and safe and predictable environments really help children who within themselves are dysregulated to feel safe at school and to be ready to learn. Positive relationships with calm and kind adults really provide a great base for children to be at school. It allows them to not be worried about things that are happening at home or in their house that they live in, and allows them to be present at school and hopefully attend to the curriculum. Staff having knowledge about trauma and the background that children can have when they're in care allow for staff to have compassion and empathy toward the children who they're teaching, and can also provide some explanation to some of the behaviour that they see. It's important to listen to the voice of the child. Sometimes that voice might be coming through their behaviour, but sometimes they will actually tell us. and providing opportunity to hear from children about what is important to them and what makes them feel safe and comfortable is important in constructing classroom settings as well as opportunities for them in their learning. We often set strong goals for children in our one plans and in our daily curriculum. It's really important to regularly review these plans and the actions that we're taking. Sometimes changes that occur outside of school can really impact on school and are worthwhile taking into account when we're planning for children. When children are moving classes or moving year levels or even moving schools, planning about those transitions can be a really beneficial thing to do. Thinking through what might be coming next and providing some support to children in their understanding of what is to come and why changes need to occur can decrease some of the difficult consequences of those changes. Finally, it's important to offer opportunities for success. It's really easy to be caught up in some of the negative behaviours that we see for children in care, but being able to provide opportunities for them to succeed, even if they are on small tasks, allows that child to have a sense of themselves as being a positive person and as being a capable learner. So recently, we have been working with the Department for Child Protection in a South office to hear from a group of children and young people who are in care about their thoughts about school and education generally. On the slide, you can see some various quotes that they have made around important things that they have to say about their experience of school and the things that they would like educators to know. So one of the things that's really important to know about is the language that you use. The language we use impacts the way people feel about themselves. And one of the items that they spoke about was when teachers use the words, "I'm going to contact your parents." Children in care do have parents, they just often aren't in contact with them. And so it's great to be able to use alternative language like, "I'm going to call home," or "Can we speak with your carers about that?" Referring to children's parents can be a bit of a trigger. Being sensitive is also really important. Often we have quite a lot of personal information about children in care, and some of their personal information is quite sensitive in its nature. One of the things that children in care have said is that conversations about their personal information are best had in private settings. We all know that it's very easy to get caught in a conversation in a hallway or in a classroom where sometimes we're saying things that are more personal than we would hope. So really they're saying here, please take care when talking about sensitive information that is about us. Children in care often have quite an acute sense of shame, and this can add to that. Another thing that was mentioned is follow-up after meetings. Some of them expressed frustration at being involved in one-plan meetings or other meetings about their future, where a lot of notes are taken by the adults who are involved, and then they're not always included in the results. They don't always get minutes. Not that children usually want minutes, but they do want to know that there's been follow-up from the meeting that they've attended. So a quick check-in afterwards from the teacher or the SSO is always a good way forward. Another issue they spoke about was their learning. Sometimes they feel that instead of being helped to learn in a different way, they're given work that is easier or that has less expectation on them. Like any group, children in care are quite diverse. Some of them are very capable learners. Others need quite a lot of scaffolding What they'd really like is for you to understand them as best you can, to tailor the learning and your teaching style to their needs, rather than just assuming that they're unable to do the work. Finally, they spoke about understanding. Know what it's like to be in care. If you do have opportunities to learn about the house that they're living in, the kind of circumstances that brought them to being in care, sensitive listening is a great way forward. Knowing what it's like to turn up at school, say, after not knowing the person who was going to be taking you to school and maybe not knowing the person who's going to pick you up, gives you some real insight into the things that impact on them in a daily way at school. There's a lot of information in this session. Hopefully there's some opportunity for you to take some time to reflect on some of the information you've heard. If you have time, there are a list of reflective questions at the end of this session, and I encourage you to have a think about students who you might have worked with before and some of the strategies that you've used that have worked, and maybe thinking through some ideas that you might have now after today's presentation. Thank you for your time today. If you have any questions or thoughts that you would like to raise with me or others in the Children in Care service, our details are on the slide, and please feel free to give us a call. Thank you.